A patient today asked about negative symptoms in schizophrenia. Negative symptoms refer to symptoms or a lack, basically, of normal qualities that an individual typically would have without the schizophrenia illness. And as schizophrenia progresses, these negative symptoms tend to get worse. Negative symptoms are believed to be a cause of hypoactivity of dopamine in the mesocortical pathway of the limbic system. So the positive symptoms, which have also been discussed elsewhere, positive symptoms are things like hallucinations and delusions. Those are from hyperactivity of dopamine in the mesolimbic pathway. However, likely due to a feedback mechanism in the schizophrenic brain, because there's a hyperactivity of dopamine in the mesolimbic pathway, you get a hypoactivity of dopamine activity in the mesocortical pathway of the brain, and that results in some of these negative symptoms. And to give you some examples of these negative symptoms, individuals with schizophrenia may over time develop a blunted affect, so a decreased range of expression basically in their face or when communicating with individuals. Another example of a negative symptom may be avolition, so a decreased motivation or decreased drive to do things that they normally would. Individuals may also increasingly become more isolated or less social, less interested in social activities with schizophrenia. Another example, individuals may have a decrease in the total volume of words that they're using. That can also be something that you see with schizophrenia. What can be really difficult is that the medications that treat the positive symptoms like hallucinations and delusions, they're dopamine blockers, typically dopamine 2 blockers. But when you give someone medication, you can't say, well, this is only going to affect the D2 receptors in the mesolimbic pathway and not in the mesocortical pathway. So when someone takes a dopamine 2 blocker to decrease their hallucinations or calm or get rid of their delusions, it may also block dopamine in the mesocortical pathway, which already has a hypoactivity of dopamine. And this is why sometimes you see a worsening of negative symptoms in schizophrenia when individuals seek treatment. It is also a very important reason why providers need to be careful to not overprescribe antipsychotics or to only use doses that are needed to give the patient symptom relief for their positive symptoms. Because if you prescribe at too high of a level and give patients more dopamine 2 blockade than they need, you may actually make their cognition worse and make some of these other negative symptoms worse, which could prevent that person from working a normal job, from positive social interactions, and from starting to flourish again after treatment. If you believe this video is anything, it's something that may pertain to you, please be sure to reach out to a medical professional. And obviously nothing in this video is medical advice, it's just informative.